Imagine giving birth to a premature baby at 24 weeks and 5 days and him being immediately rushed away because his head was swollen. This is what happened to this little boy born at 24 weeks and 5 days. He was rushed into a resuscitation room because he wasn't breathing when he was born. And so the doctors thought that he was anemic, and they found out that he had this thing called hydrocephalus. Hydrocephalus is an increase in blood and fluid inside the brain, and it causes the brain to have a lot of pressure and swell up. This usually occurs when there's a difference between the production and absorption of the CSF, which is the cerebral fluid. Hydrocephalus in infants is estimated at between 0.48 and 0.81% of 1,000 births, live and still. Many of these are due to multiple etiologies. Hydrocephalus most commonly occurs due to mechanical or function abnormality in the CSF pathway. This leads to an increased pressure and the rapid enlargement of the reticular system. It is mainly diagnosed by signs, as infants and small children cannot tell exactly what is going on. The signs include excessive head growth of serial measurements and head circumference, or growth curves that fill or are distended in the interior frontal. Frontal bossing and the scalp veins may appear dilated and prominent. These are often diagnosed at infancy with enlarged head circumferences. Hydrocephalus can be treated with non-surgical and surgical options. The non-surgical treatments include diuretics, fibrinolysis, and the serial lumbar punctures. They have significant complications and are less effective than surgical treatments. Surgical treatments are preferred and include drainage of the CSF via reservoir or placement of a ventricular peritoneal shunt, or called VSP. And it is often the first form of treatment. The VSPs approximately fail 40% of the time within the first year of placement. A secondary option, instead of fixing the shunt, is called an endoscopic third ventriculostomy, or an ETV. This connects the first ventricle to the subarachnoid space and commonly used as an alternative to the shunt replacement. The success depends on the cause of the hydrocephalus and the previous complications. Survival rate without treatment is very poor, but with treatment, the survival rate increases to 89 to 95%. The outcomes from hydrocephalus depends on etiology, complications, and associated abnormalities. These abnormalities include seizures, which can cause both a poor functional and cognitive outcome. It is estimated that children with hydrocephalus that have seizures at birth or after, within the first couple months in the NICU, they need special school, as their brain and motor functions are less than normal, which is what happened to this little boy. He was rushed away to the resuscitation room and was pale and limp with no respiratory effort at 24 weeks and 5 days. His heart rate was initially above 60, but dropped drastically after placement in the resuscitation room. An intubator had to be inserted into his lungs so that he could learn how to breathe on his own, and once successfully intubated, the infant was transferred to a NICU for further care. 2 weeks later, an ultrasonography was performed showing involved right grade 4 and left grade 2 hemorrhages with decreased mass effection on the ventricles. A reservoir was placed to draw out the excess fluid. And also a ventricular peritoneal shunt was placed in his head to try and reduce the swelling. 2 months later, they performed another non-contrast head CT, showing no significant changes compared to the prior exam. No new intracranial hemorrhages, midline shift, or mass effects were shown. Due to the unchanged hydrocephalus, another ventricular shunt was placed. There was complications with the VPS, which caused the placement of the endoscopic third ventriculostomy. After another non-contrast head CT was performed after the revision, there showed no significant decrease in size of bilateral ventricles. The boy ended up surviving, and he was placed into a special school after a couple years, and he was like ready to go to school. So hydrocephalus is a very intense disease that happens when your brain swells, and if not further care is taken, it could lead in death. But luckily, doctors are able to diagnose it soon, and proper care will be instructed.